At age 7, Marnie Golden was diagnosed with non-Hodgkin's lymphoma.
The word cancer didn't scare me as a kid, but the word chemo did. They were going to give me chemo, which means they're going to stick a needle in my veins and put chemicals in my body and make my hair fall out, but also kill the cancer cells.
After chemotherapy, radiation, and a bone marrow transplant, her cancer was eradicated. But Golden, now 31 and an aspiring opera singer, has multiple health issues attributed to her treatment.
Then you find out that you have very high cholesterol, you have thinning of the bones, and your thyroid's enlarged with nodules, probably from the radiation. What are you thinking?
You know going into the treatment that there's going to be side effects, and every cancer patient is going to have different side effects, and I guess these are the side effects that I got.
But these side effects can develop years later. And a new study shows that for Golden and many others, the effects often go undetected. More than 1,700 adults, formerly patients at St. Jude Children's Research Hospital, were monitored for complications of their therapy. 2/3 of patients had developed a chronic or life-threatening condition. Until the study, patients were unaware of almost all of the heart problems and more than half of the lung problems.
I do want the pediatrician to follow up.
Dr. Melissa Hudson is the study's co-author.
Survivors of childhood cancer, once they graduate from pediatric programs, they're going into a community where that medical providers are not going to be aware of their unique health risks.
You don't think about taking care of yourself when you feel fine.
And is there part of you that just wants to say, that was me as a girl who had cancer, that's gone, I don't even want to think about it again?
Sometimes.
How do you fight that?
I guess the thought for me is just the knowing that if I don't take care of myself, I will never be able to reach my dream.
Dr. Jon LaPook joins us now. So how does a study of treatment 25 years ago affect how cancer is treated now?
We've learned so much about how to be more targeted. Back then, we gave chemotherapy and radiation and steroids, and yes, we cured the cancer in a lot of cases, but we really harmed the patient. And now with these more targeted therapies, the trick is to leave the normal tissue perfectly fine and to just target the cancer cells. Try to hit it with a sniper rather than a howitzer where you end up blowing up the whole person.
The quest for precision. Jon, thank you.